cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umbok-umbok dito sa leeg niya. Hindi ko talagang inisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates, so it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number 1, cellular differentiation. Number 2, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose. to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like simply nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Talagang sobrang sakit. Sumusuka na ako. Tapos sa work ko rin, hindi ko na kaya talagang mag-isip. Dumating ako sa point na nawala na din daw ako ng malay. Then, nakilala ko si Sir Shyan. Meron silang ganung product. Effect sa akin ng supplement na to is malakas ako. Kahit nagkikimo ako, nag-radiation ako. Hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, walang ganang kumain. My name is Saida C. Gomez, 48 years old. I live in Quezon City. Currently work is a property manager. Diagnosed sa akin is breast cancer no year 2019. After 2.5 years, is recurrent na siya for stage 4. Affected na yung brain, then lungs and liver. Kumalat na siya. Yung symptoms na naramdaman ko is talagang sobrang sakit nung ulo ko. Gumising ako, parang sumusuka na ako. Tapos yung umiiba-iba yung way ng walk ko. Talagang as in, vomit dito, vomit dun. Tapos sa work ko rin, talagang hindi ko na kaya talagang mag-isip. Parang lagi akong masakit talaga ang ulo. Na dumating ako sa point na nawala na din daw ako ng malay. Sabi ng mga kasama ko doon. Inaakay na nila ako. Then, yung pinakamatindi is yung dito na sa bahay na talagang inaano ko nung husband ko na gumigising ako pero talagang ayaw kong gumising. Kaya dinala na niya ako ng ER. Tapos doon na sila nag-test. Nagising na nga lang ako, nasa room na. Parang minuto na nga lang, wala na ako. Kasi talagang yung namamagana, swollen na yung brain ko. Nang ma-diagnose ako ng 2019 na I have a tumor, bukol, hindi ako nagpa-chemo. Basta it's natural, concentrate ako sa natural. Then, after ng 3 months, sabi nila, is kailangan ko na daw ipatanggal. So, hindi na siya babalik. So, pumunta ako ng hospital, natanggal naman siya, then, still, natural pa rin na product na aking tinitake. Pero, bumalik siya. Stage 4 na. Kasi nga affected na yung brain ko, lungs, liver. Actually, may ano na siya, sign na para sa bone. Yun yung mga nakita sa CT scan ko. Then, nakilala ko si Sir Shyan na meron silang ganung product. PPARs na powder and tablets. Yun yung trinay ko habang nag-start na ako ng radiation ng 18. May, nag-chemo na ako. Natapos ko yung radiation ko for 10 session. So, okay yung effect. Nakayanan ko siya. May, nag-start na rin ako ng chemo para dun sa lungs and liver ko. And yung abdominal, kasama na rin siya. Every 21 days, 3 days yung aking chemo. With the help talaga nung Simply Nature, hindi ko naranasan yung nakikita ko sa mga kasabayan kong nagkikimo na nagsusuka, sumasakit, giniginaw, may mga ganun, tapos parang hindi talaga sila makakain. Minsan nga, hindi nila natatapos yung treatment nila. Pero ako, natatapos ko siya, is 3 days pa, na ang recommended sa akin is dapat naka-admit ako ng 3 days. Since tight lang din ako sa budget, is nag-decide na lang ako mag-uwian. Kasi strong ako, kaya ko. The following month ulit, nakaya ko siya ng hanggang 5 cycle. Di ako nagsusuka, nagugas ng plato, may konti akong pinagkakabalhang tindahan. So, nagagawa ko. When I was diagnosed stage 4 cancer, I cried, of course. Hindi mo naman maiiwasan yun. Pero I never felt na hindi ko kakayanin. Parang kailangan ko lakasan ng loob ko para sa family ko, lalo na sa mga bata, sa mga anak ko maliliit pa sila. Yung husband ko, naiyak siya, syempre. Pero nung makita niya akong lalaban ako, parang nadagdagan yung fighting spirit niya na talagang lalabanan natin to, mami, sabi niya ganun. Narinig ko nga sinabi ng doktor na less than a year ako, pero hindi ako kinabahan. Tinitake ko is P-Pars powder, 2 scoop. Nilalagay ko siya sa ilalim ng dila para ako matulog. Then 15 tablets every morning, empty stomach. Then sa afternoon din, 15 din ulit. Bumibili rin ako ng cleansing para panglinis. During chemo, radiation, ginagamit ko siya. Effect sa akin ng product, ng supplement na to is malakas ako. Kahit nung nagki-chemo ako, nagre-radiation ako, hindi ako nanghihina. Kaya kong bumalik sa normal na kilos ko after ng chemotherapy ko. Happy ako sa mga result kasi after 3 months, pinag-CT scan na nga nila ako at saka MRI, good yung development, nabawasan lahat yung mga measurement. Siguro yun yung effect talaga ng supplement na tinitake ko. This month is naka-evaluation, PET scan na po ako. Happy ako dun sa result ng CT scan at saka MRI. Kasi nga, yung sa MRI ko, yung sa brain is from 1.09, naging 0.08 na lang siya, yung measurement niya. Then yung sa lungs ko, which is yung chest scan ko, is 9.05, naging 4.05 na lang. I will recommend Simply Nature to other cancer patient kasi it's very effective for me. Kahit nag-treatment ka at tinitake mo yun, hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, then walang ganang kumain. Hi, I'm Saida Gomez. I have stage 4 breast cancer, metastasis for the brain, lungs, liver, abdominal, and bone. Thanks to Simply Nature, I'm okay now, and I trust Simply Nature.
Good evening, everyone. My name is April, your host for tonight, and you are watching another episode of Simply Nature webinar, your long-time running healthcare awareness webinar here on social media. This program is powered by Simply Nature International and SMG, or Simply Healed Medical Group. Tonight's topic is entitled Surviving Chemo with Your Onco. Cancer protocol from oncologists. Cancer is a battle that affects not just the body, but the mind and spirit as well. In the next few minutes, we will explore the journey of undergoing chemotherapy, the critical role your oncologist plays in the process, and the strategies and support that help you not only endure but thrive during this challenging time. By the way, we appreciate each and every one of you for watching and registering for this webinar. Also for sharing this online event with your friends and loved ones who are also undergoing chemotherapy. This is a free webinar, so feel free to tag, share this with your family and friends. To start off our discussion for tonight's topic, let's welcome Dr. Jansen Kalalan, a graduate from St. Luke's Medical College of Medicine in 2016. In 2019, he was conferred as a diplomate of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He is also the president of Simply Healed Medical Group and a consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center Las Piñas, where he manages patients with cancer and metabolic illness. And our next speaker is a successful entrepreneur and international speaker on a wide range of topics, from personal success to healthcare. The CEO and founding director of Simply Nature International, our PPARS expert from Singapore. You all know him, no other than Mr. Shyan Lim.
Hi, thank you, April.
Hi, Sir Shyan.
Hello to all our regular viewers, all right? We are growing the team. So today, you all know Sheila, our regular host, and Jen as well. And now we just want to welcome April to the Simply Healed broadcast team. So this is April's first broadcast. So tonight, everybody, be encouraging to her. If you can type in some encouraging words in the chat. Tonight's topic is on chemo, and our guest speaker is actually Dr. Jimmy Catapia. Dr. Jimmy is an oncological surgeon, and he also administers chemotherapy. And just a quick heads up, because this coming Saturday at 8:45 a.m. to 11 a.m., we're going to have a face-to-face, and Dr. Jimmy is one of the doctors on the panelists. So if you don't get your questions answered today, you can ask Dr. Jimmy in person. You can ask him about chemotherapy. You can ask him about surgery. And so later also, we will be having an AMA, Ask Me Anything segment, our usual AMA. And tonight, we're glad to say that Dr. Jansen is back to join me. So last week, I did it solo, but today, Dr. Jansen is back to join us. And I already can see there are very good questions being typed up in the chat for this webinar. So continue to type your questions. Our client service officers will pick them up. And April will share your questions with us later during the Ask Me Anything segment. So let me hand the time back to April. So April, you're doing a good job. Welcome to the team.
Thank you, Sir Shyan. Thank you for that wonderful introduction. By the way, let's not keep you waiting, guys. Let me introduce our next speaker, Dr. Jimmy Catapia.
Just don't be scared to have chemotherapy. There are many options to decrease or to lessen the side effects of chemotherapy. One such sample is PPAR agonist. PPAR is actually backed by science, no? So don't just believe in whatever you see. Make sure that the sources are respectable institutions. Actually, I have here a study published in Hindawi. It's a respectable collection of scientific literature. It showed here that PPAR agonists, it can actually protect the bone marrow from the side effects of platinum-based chemotherapy.
Hello everybody, welcome to another episode of Simply Healed. Today's episode is a great one for those of us who are concerned about cancer. The title of today's episode is actually Doing Chemotherapy Successfully. Yeah, and our doctor guest for today is our good friend, Dr. Jimmy from Manila Med.
Hello, Shan. Hello, everyone. Thank you for having me here.
Yeah.
So, I'm actually practicing for more than 10 years already. That's combined during my training in VGH and during my private practice.
And actually, Dr. Jimmy is very famous. If you go to YouTube and take a look at Manila Med, he's actually one of their spokesperson for the oncology department. And every time our team goes to his clinic, we end up waiting for hours. And when we sit down and ask his patients outside his clinic waiting to see him, it's always the same thing. They always tell me, Dr. Jimmy, this is why we like you. Your patients actually told Emma, and Emma shared with me, your patient says Dr. Jimmy is different. He's very caring. So, Dr. Jimmy, I think the question on many patients' mind is that why is chemotherapy effective? Why is it necessary? Because, if we go on the internet to Google, many times the first thing we see is all the bad news about chemotherapy.
I think I have to start first by defining chemotherapy. So, chemotherapy from the word itself, chemo, chemical, then therapy, treatment. So, it's just a chemical treatment. They use medications or drugs to treat cancer. Okay? So there are actually different types of chemotherapy. There are 3 types. The first is what you call neoadjuvant chemotherapy. Neoadjuvant chemotherapy, its goal is to make unresectable tumors become resectable. And also, for you to determine sensitivity of the tumor to a particular drug because the tumor is still there. So in vivo, if you give the medication, the chemotherapy, you will see for yourself if the tumor will shrink in size. So if it shrinks in size, it means it's sensitive to that drug. The second type of chemotherapy is what you call adjuvant chemotherapy. It's what you give after the surgical treatment of the tumor, particular tumor. So its goal is to target micrometastasis, what you cannot see grossly, and second, to prolong the survival and to decrease the recurrence of the tumor. Then there's another type, what you call palliative chemotherapy. That's the last one. Okay? So for palliative chemotherapy, that is reserved for usually for stage 4 patients or for those patients whose tumor are not resectable. Its goal is to prolong the survival of the patient and also to give good quality of life. Okay, take note, good quality of life.
Wow. Doc, I mean, this is the first time I hear, because when you go to the internet, when you type chemotherapy, you would not associate with the next 2 words, good quality of life.
Yes.
A lot of articles that we see on the internet is always talking about the side effects of chemotherapy. But Doc, that's a very interesting topic about how chemotherapy is actually used to give good quality of life. We'll explore that a little bit more. Doc, back to chemotherapy in all its different categories. What are the major concerns that people have about chemotherapy valid? Does chemotherapy really have side effects? And what is the percentage? Does everybody who uses chemotherapy have side effects? Or are there some people who use chemotherapy and have no side effects?
Actually, it's not a myth. There are chemotherapy agents or drugs actually have side effects.
Okay.
Some are actually serious side effects. Before, those side effects are really terrible. But with the newer drugs nowadays and, of course, newer options, those side effects are lesser and lesser.
Dr. Jimmy made it clear to us that chemotherapy are drugs. So even like your cough mixture that you drink, drugs have side effects. But there have been great improvements over the years. Yeah. The side effects have diminished. Now, the second question was, does everybody react negatively, or is it only a certain percentage? Are there people who use chemotherapy and actually have no side effects? I mean, generally that they actually feel so good.
A few percentage of patients actually have no side effects at all.
No, I'm not.
Yes. Some patients actually tell me, Doctor, did you really administer me the medication or the drug? Because I did not feel anything. Is it really working? Because some patients have a misconception. They think if there are side effects, they think that the medication or chemotherapy drug is working.
So there you hear it directly from Dr. Jimmy himself. Wow, there are actually patients that do well on chemotherapy and have no side effects. Doc, nowadays for cancer treatment, there are so many options. And we'll talk about conventional medicine as today's focus. Immunotherapy is very promising. Why do we still do chemotherapy if there's immunotherapy?
Nowadays, because of newer technology, newer researches,
Mm.
I think there's a shift. There's already a shift going to the use of immunotherapy and targeted therapy, and shying away from the development of new chemotherapeutic agents.
Mm.
But still, chemotherapy drugs will stay. I don't know for how long, because these immunotherapy drugs, these targeted therapy drugs, are still not perfected.
Oh, they're still not perfected. So,
Usually, they are used in combination with these chemotherapy drugs.
okay, so that's good to know that, and it's true, Doc. I've spoken to some patients, like for breast cancer, they use a combination of some immunotherapy and some chemotherapy drugs. Doc, I mean, we are in Asia, and Asia has developing economies. So one of the things about cancer is expensive to treat.
Yes, very, very expensive.
Very expensive to treat, right? Now, is immunotherapy important because it's also more affordable?
Actually, they are more expensive.
I heard that immunotherapy, one session can be 100 plus.
More than 100,000.
More than 100,000. So,
Sometimes you need more than ₱1,000,000 to complete.
wow,
the
more than
cycles of
₱1,000,000 to
immunotherapy.
complete. Wow. Okay, so that is something very real. I think out there, I've met so many cancer patients that it's not only the drug treatment. They are so stressed about the medical bills. So so we shouldn't be upset with. We should be more receptive to exploring chemotherapy because it's affordable, it's proven, right? Because it's been used for a long
Yeah,
time.
it's been used for a long time.
Mm.
It's more affordable in comparison with immuno and targeted therapy.
Mm.
But it's better to combine the two, because researchers have proven that combination of chemotherapy plus the immunotherapy most of the time will improve the survival of the patient, both overall survival and disease-free survival.
I think that's really important for all the cancer patients who are listening to us. You got to find out more. Don't just read headlines on the internet. You got to find out more details. I was very surprised that. Do you know that if you take PPAR agonist, which is what is found in Simply Nature PPARs, it has been already proven in research that PPAR agonist actually improves the efficacy of some chemotherapy drug agents. They've seen it in the PPAR drugs. I think triglycerides, when you use with certain chemotherapy agents, actually have better effect than the chemotherapy agent on its own. So actually, there are a lot of information that you have to look into specific to your cancer. Yeah. But Dr. Jimmy, is there any advice you can give our cancer patients? How do you actually successfully go through chemotherapy? What should you do as a patient?
Actually, as a doctor, the first thing I have to do is to connect with the patient.
Mm.
I have to make the patient believe in the treatment.
Yeah,
That's the
important.
number one. But that's my number one goal. The patient should believe that the treatment will help him or her, and the treatment will cure or prolong his life.
Yeah.
And give good quality of life.
I want to encourage everybody, if you are looking for a good oncologist, just drop us a note on our Simply Nature Messenger on Facebook. We'll connect you up with Dr. Jimmy. All right, because we've heard from so many of his patients. I think very important in a good doctor is someone who cares. Yeah, all right. So thank you, Dr. Jimmy, for caring. Okay, so Dr. Jimmy, we know when I've met patients who do chemotherapy, so they find a lot of difficulty if they happen to have side effects. What are the most common side effects for chemotherapy?
Actually, the most common side effect is first, vomiting.
Okay.
Some will have severe vomiting episodes even during chemotherapy or after chemotherapy.
Mm.
Number two is the weakness, body weakness.
Body weakness.
Yes.
All right.
Some would have diarrhea, and the most fearful side effect is the depression in the immune system, which is sometimes manifested by a drop in the white blood cell. We call it leukopenia. No?
Okay. So that is very important because we need the immune system to
Yes.
to fight the cancer.
Yes. If
Alright.
your immune system drops,
Mm.
then you will be very susceptible to different types of infection.
Okay, and
The
that will
first one,
complicate your cancer.
And sometimes the first manifestation is having oral ulcers because the bacteria that actually harmless becomes harmful if your immune system drops.
Wow, so the fact that you have mouth ulcers is an indication that your immune system is already being compromised.
Yes.
Wow. So what are the things that patients should do when they are undergoing chemotherapy? What should they really look into their nutritional intake? Should they even be taking supplements? Should they be taking vitamin C, multivitamins, all that? I mean, is that important part of chemotherapy?
Patients should strengthen their immune system. Okay, some basic ways to strengthen the immune system is to have complete rest, no? Then intake of large amount of fluids, and of course nutrition. Oo. I know many oncologists, both medical and surgical oncologists, who just give multivitamins, just prescribe multivitamins, vitamin C. But actually, there are many options. Actually, some would give food grade supplements.
Like Simply Nature.
Like Simply Nature.
Yeah.
Actually, I have here a study published in Hindawi. It's a respectable collection of scientific literature. It shows here that PPAR agonists, it can actually protect the bone marrow from the side effects of platinum-based chemotherapy.
Wow. You know, actually, this is research that we just published in 2020. It's actually done with our Simply Nature PPAR extracts. And just for our listeners out there, we tested it with cisplatin. So cisplatin, doc, is a very common
It's a common chemotherapeutic agent.
And one of the side effects of cisplatin that you can go and check on the internet, I mean, you can go to the medical, like Mayo Clinic and all these websites, they actually list out some of the concerns of every chemotherapy agent. So one of the concerns is it does damage the bone marrow.
The bone marrow.
Yes, which is why I think Doc Jimmy works with us in Simply Nature because our supplements are food grade. Oh yeah, we were just having a conversation just now with Dr. Jimmy that Chinese medicine like ginseng and lingzi, these are not food grade. These are medicinal herbs. So medicinal herbs can possibly have contraindications with therapeutic agents like chemotherapy agents, all right? Because these are not food. So they have to be used under, you should get, if you're using Chinese medicine, don't just buy off the shelf, right? You should really go to a traditional Chinese medicine practitioner, especially one that is actually trained in conventional medicine too. So Dr. Jimmy was just telling me in China, they have very integrative, holistic approaches.
There's a popular hospital in China, actually a cancer hospital. I will not mention the name.
Yeah, we won't mention the name.
But I know many patients seeking consultation there. Some are being admitted and treated. I reviewed actually the methods of the hospital. I think it's holistic. It uses Western medicine as well as Eastern medicine. It's a combination of the two.
Yeah. And this is just so that our listeners out there who are very interested in like Chinese products for cancer, I want to advise you because I'm Chinese, right? Is that if you want to do that, you can actually go to the professionals because for you to become a doctor in China, you do have to go through a certain amount of both conventional and traditional medicine. So every conventional oncologist in China has taken some modules in traditional Chinese medicine. And it's the same. Traditional Chinese medicine practitioners have to know a bit about conventional medicine. So those are the professionals who will be better to advise you on using medicinal herbs in your combination with treatment with cancer. Right? But if you're talking about supplementation, then you can take a look at Simply Nature because that's food grade. We are food grade, we're not medicinal herbs, and yet we have all these wonderful published results.
Yes.
Yeah.
PPAR is actually backed by science, no? So don't just believe in whatever you see. Make sure that the sources are respectable institutions.
So, that's a good advice. So, what are some of the respectable institutions when it comes to medical research?
Actually, Cochrane, Hindawi, the likes of that.
Yeah, and PubMed, right? PubMed is...
PubMed, yes, PubMed.
PubMed as well. PubMed, Hindawi. Okay. Doc, I just wanted to show some slides. Our audience, you can take a look at the picture on the slides. Now, Dr. Jimmy was mentioning how our research shows that it can protect the bone marrow cells. So take a look at the picture on the left and on the right. Okay, this is what happens when cisplatin is being administered to a patient. The bone marrow gets hurt. All right, the bone marrow cells get hurt. But when a patient is on Simply Nature PPAR extracts and cisplatin, look at these pictures. You can notice that the bone marrow cells are actually intact. And this is the same for the spleen. Now, this has big impact on you because you will feel strong, you'll be healthy, your bone marrow is an important part of your immune system. And that will allow you to fight cancer more successfully, right? So there's the good news. Doc, do you have any advice, other advice for patients going through chemotherapy?
Okay, that's a good question. For cancer patients, first of all, not all cancer patients will undergo chemotherapy.
Oh?
Yes.
Okay, I thought that every cancer patient will be... No. Okay.
It depends on different factors like the stage, the grade of the tumor. There are several parameters that we use to determine which patient will undergo chemotherapy. Okay, so for those who will undergo chemotherapy, I know it's very expensive, especially with the healthcare system of our country. But there are many options for you to be able to acquire chemotherapy drugs and to be able to have the treatment. Okay, so we have other institutions like the PCSO, the DSWD to help you to have the chemotherapy treatment. Okay, so for patients, don't be scared to have chemotherapy. There are many options to decrease or to lessen the side effects of chemotherapy. One such sample is PPAR agonist. Okay? So, and also you have to follow what your doctors are saying to you. Their advices are very important.
Dr. Jimmy, the next question I want to ask I hope it is not too controversial. But anyway, Doc, is this many oncologists, right, would say, don't take anything while you're going for my treatment. Don't use this network marketing products or whatever because I cannot vouch for that. It might conflict with the treatment. How do you advise patients who meet doctors or they're having problems or challenges trying to explain to their doctor they would like to go for some supplementation, even as simple as eating malanggay capsules and things like that?
Actually, the concern of those most of oncologists are valid. No, that concern is valid.
Yes, it's valid. We have crazy products outside.
Yes, so the key here is to have a good communication with your doctor. Everything that you want to take, especially supplements, you should tell them to your doctor. Okay, so because during chemotherapy, we actually monitor the patient's creatinine for the kidney, the liver enzymes, the cardiac function, and also there are other substances that are maybe present in the supplements that you want to take that may interact with the action of the chemotherapy drugs that you are using. So communicate with your doctor. If your doctor naman will find the supplement to be safe and can be used together with the chemotherapy, and maybe your doctor will allow you to take that.
All right, so for all the listeners out there, you have two options. Okay, one option is you can always give Simply Nature, drop us a message. All right, we will be happy. We have our MedRep teams. Right? We distribute our products through doctors. So we have people that can go to your oncologist, and help talk to your oncologist to explain, or we can send data to your oncologist that you can show your oncologist, so that you can work together with your oncologist to complete your chemotherapy sessions successfully. You can also always have multiple opinions. Yes, you know, I visit many cancer support centers. They always advise that you should at least have two, even three opinions before you start on a protocol. So it's always good to speak to different oncologists, and then you compare their advice and choose one that will fit into your goals and your lifestyle. So Dr. Jimmy is very familiar with our product, and I've heard Dr. Jimmy talk about how his goal in between chemo sessions is to help the patients strengthen themselves so that they can go through
So that they can complete the chemotherapy sessions.
because it's important, right, Doc? If you don't complete your chemotherapy session, it's not going to be so effective, is it? How important is it to complete the cycles that you prescribe to the patient?
The number of cycles that we give to the patients are actually well studied, no? They compared, for example, 8 sessions versus 6 sessions. So it's not just it's not just it's just that we want to give you 8 sessions versus 6 sessions. Those number of cycles are very well studied. The side effects, with consideration of the side effects, with consideration of the toxicities. Okay, so you have to complete the sessions, okay, to have the optimal effect of the chemotherapy.
So it's a little bit like antibiotics, diba?
Yes.
That you don't just because you feel better after you're supposed to go for 8 sessions of chemotherapy, just because after the 3rd session you feel good, and then you stop. Is that a good idea?
No, that's not a good idea.
Or I just want to share with our audience. You know, I've actually met cancer patients who take our Simply Nature PPRs and then do well with the chemotherapy, and then they feel good. And because they feel good, and it's true, right? Cancer treatment is not cheap. So they thought they would like to save money. They should be well now because they feel good. And then they stopped the sessions. And it turns out after that, because they stopped the sessions, the cancer metastasized, and it was more difficult to treat. So I would like to advise cancer patients that are going through chemotherapy to go through the prescribed number of chemotherapy sessions your doctor is prescribing to you. Now, if you are worried whether your onco is prescribing too little or too many chemotherapy sessions for your case, just go for more than one consult. Get more than one opinion, right? Then you will be able to come to your own conclusion. Once you decided, stick to the number and complete it. And what we can do to help is that if you take Simply Nature PPR extracts, it will strengthen you and allow you to complete your program successfully with very little side effects. All right.
Our goal is quality of life.
Goal is quality of life. Doc, you were talking about using chemotherapy for quality of life. That is something new. Can you share a bit more?
Especially for patients who are very symptomatic because of the cancer or the tumor. I'll give you an example. For example, there's a tumor blocking the airway, so the patient has difficulty breathing. If you give chemotherapy, shrinking the tumor will improve the patient's airway, so the patient will be able to breathe more comfortably. So that's quality of life.
Wow, that's a good example. Doc, you are a surgical oncologist. So I guess I want to take the opportunity to leverage on your experience and your specialty here. Is surgery is surgery a good option when it comes to cancer?
Not all cancer will need surgical intervention.
Okay.
Okay, but most, not all, but most solid tumors will need surgical intervention. No, exceptions are those that are not resectable, some stage 4 cancers. But surgery is actually a very big part of cancer therapy.
Okay, how scary is surgery? I know in Asia we are very uncomfortable with surgery. My mom is so afraid to go to hospital. She's not afraid of medicine. She's always afraid of surgery. So can you share with us how safe is the surgical procedures that you do for cancer? I mean, how fast can a patient recover from surgery? You know, can you cut out your liver? Will it grow back? These are questions that in general people have.
Cancer therapy nowadays is going to the multidisciplinary approach. Yes. So not a single doctor can cure your cancer.
Wow!
So even before the patient undergoes surgery, most of the patients will have to undergo a multidisciplinary conference for different doctors to plan what to
Wow!
do with the patient, even the surgical part.
Well, Doc, you said a magic word just now. I can't believe Doc Jimmy actually said it. But that just goes to show you why patients love Doc Jimmy. Doc Jimmy actually said that no one doctor can cure your cancer. It's a multidisciplinary approach. So there goes a good gauge to know whether you have a good doctor or not. The doctor will be able to admit to you that he alone can't cure your cancer, but he'll work in a team. Doc, but when you talk about a team, if I'm a patient, I'm very scared because when I hear team, I think that the medical bill is going to be very high. How expensive is it for the consultation process when you're talking about deciding what to do with your cancer? How much should a cancer patient be prepared to spend for consultation to come up with the plan and not even before the actual treatment?
Of course, if you're in a private hospital,
Okay.
so expect.
Oh, that's very expensive.
Yeah.
But what if we talk about? Let's talk about what's available to in general hospitals, in hospitals that are not private. How much would a patient have to prepare himself for?
There are many good government hospitals. Actually, not just good, very good.
Very good,
government
huh?
hospitals,
Mm.
no? Wherein you can get your treatment for free.
Really?
Yes.
Okay, praise God. Then you can then use your budget to buy Simply Nature Pipas to make sure your treatment is comfortable and no side effects. Oh, that's very great news, Doc. Oh, okay, very good. Okay, Doc, any last words before we end? Any key ideas you want patient with undergoing chemotherapy or thinking about going for chemotherapy that they should remember?
So cancer is a very complex disease. Okay, that's why it also needs complex treatment. No, so one modality of treatment is chemotherapy.
Mm.
So don't be scared to undergo chemotherapy. Chemotherapy should be safe if done properly. Chemotherapy should have less side effects if given the right, let's say, adjunct
Adjunct
medications or
therapy.
therapy.
Mm.
Okay? So just like one sample is the PPAR agonist. Okay?
Mm.
So I have many patients who are taking the PPAR agonist, they were able to complete their chemotherapy
Oh,
sessions.
so they were feeling too bad to continue, but once they took it, they feel strong enough. Wow, that's very good news. Thank you, Doc Jimmy. Doc Jimmy shared one wonderful news with us on how you can successfully go through chemotherapy. If any of you are feeling difficult, you're going through chemotherapy now, is very difficult. You are committed, you know it's helping you because the tumors are shrinking, but yet it feels horrible because of the side effects. Then drop us a message. If you want to consult with Doc Jimmy, go ahead, because Doc Jimmy just shared a solution, which is some of his patients have difficulty in between the chemo sessions, and with the Simply Nature PPAR products, they got strong enough to continue with their chemotherapy because the chemo was working. So if that's you, then we can help you today. All right, so thank you again. Thank you, Dr. Jimmy. Thank you very much. We look forward to having Dr. Jimmy with us again. Bye-bye.
There we have it. Thank you so much, Doc GB and Sir Shyan, for that informative and encouraging discussion. For those of you who are diagnosed with cancer, don't lose hope. Cancer is not curable, especially when discovered in early stages. Surviving chemotherapy with the support of your oncologist is a journey that requires resilience, trust, and collaboration. Chemotherapy is powerful, but often challenging treatment for cancer. And the role of the oncologist is essential in guiding you through this process. And also, diet and lifestyle are very important contributing factors as well. We are now in our what we call AMA portion. At this point, Questions are very much welcome. Just type in and list them down in the comment section below. For now, I would like to shout out to our regular viewers, Miss Lily Lu from Malaysia, Miss Susan Patane, and also Miss Josephine Chua. Webinar is not the same without you. And to answer our questions for tonight, I'd like to call on Dr. Jansen Kalalan. And of course, let's call on once again the CEO of Simply Nature International, Mr. Shyan Lim.
Hi, April. Thank you. Hi, Doc. Good to see you
Hello.
again.
Hello, Doc.
Hello, everyone.
Sir Shyan.
Hello. Happy to
Yeah,
be here.
I missed you last week.
Yes,
There were
yes,
some-
because I had emergencies that I need to
Yes,
attend
yes.
to. So, yeah.
Yes, we had some medical questions which I'm sure you are going to answer today. But that was a very interesting discussion with Dr. Jimmy about surgery and cancer. And Dr. Jansen, I'm looking forward to Saturday morning. I will be with you and Dr. Jimmy live at SMX Aura to answer questions. I think there's a very good turnout already, so I'm looking forward to all the viewers who are in Metro Manila. I encourage you, just walk in, don't worry, right? There will hopefully we made sure that the theater can be expanded. All right, so just bring your family members too. It's always nice to ask questions together. Yeah. So are you ready, Doc Jansen? You're going to be the keynote speaker for Saturday.
Yes.
Yes, I'm actually excited already to see everyone there. So, I hope some of our audience who are watching right now can attend and see you. Okay.
Yeah, we have a few celebrities that are coming. Doc Jansen, you were saying that your mom wants to get photos with them.
Oh, yes, yes, yes.
Yeah, but we won't be able to tell you who are coming because not nice lang. If they come, they will be there. All right. So if you want to know who will be there, just come. All right.
Okay.
April, let's answer the
Yes,
question.
thank you, Sir Shyan and Doc Jansen. Welcome back. And as of now, I can see a lot of questions coming in. Shall we start, Sir and Doc?
Yes.
Okay.
I think April, I'd like to start with the one that I actually responded a little to. So Wilfred asked that, stage 4 rectal rectal cancer right now. He's taking chemotherapy drug. Any recommendations? My first recommendation is at stage 4 cancer, I'm sure if you do a consult with Dr. Jansen, he'll tell you to go on the liquid extract. All right. So as Dr. Jimmy said in the discussion, no one person can cure you of cancer. I think that's a very presumptuous thing to say for anyone. Dr. Jansen and I just had some sad news also recently because one of our cancer patients who was doing so well actually had complications later because she stopped the protocol, right? So that's another thing that it's so sayang for us because by the time we found out it was too late. So when you're treating cancer, do everything that you can and don't stop. All right. So this patient of ours actually did well and was cancer free. She was supposed to be very little hope, very unlikely that she'll do well, but she actually did well. And then after that, she fell off our radar for about 3 months. And then what happened? And then during the 3 months, we are not sure what happened, but the cancer came back. And by the time we found out, it was too late. So I just want to share with everyone that when we hear news like that, we're so sad because that patient actually was a recurrence already. So this is the third time. And it was really a no-hope case in the beginning, but she did well and she basically recovered. But, with cancer, you cannot let your guard down. All right. So to all the cancer survivors right now, those of you who have been declared cancer-free last year or this year, there's a reason why it's the 5-year mark. And even after that, there's a next, you keep monitoring, right? It's not something that you let your guard down. I remember meeting one cancer survivor came to my office to ask about our protocol. She has survived cancer for 25 years. That means she has been cancer-free for 25 years. I think she had it in her late 30s. So when she came, it was already 50 plus. She's already 50 plus. But I just want to share with you how important it is. This cancer survivor, after 25 years of being cancer-free, actively search Simply Nature down to find out more about our protocols. I think this is the reason why after 25 years, she is cancer-free, because she did not relax. She really made an effort to continue to ensure that the cancer does not come back. All right, so to Wilfred, yes, I would recommend you straight, either the liquid or extract powder, because yeah, stage 4 cancer. I would also recommend that you go for a consult with Dr. Jansen, as since you're undergoing chemotherapy. I'm sure Dr. Jansen will be able to assist you to better understand what more you can do apart from Simply Nature protocols. Doc, what do you think?
Yeah, I totally agree. It's best to combine these protocols, no, not just rely on one singular treatment, because with cancer, we can't always. There's no 100%. Okay, even with the studies that they publish, the medications, etc., especially the novel ones, the newer ones, it's still not 100%. I mean, out of 100 patients, only what, 40, 60% will get cured. So what happens to the rest, right? There are these factors. So since we know that not everybody will respond to the treatment, it's all probability, then we have to make sure that we combine all treatment that we can afford, okay, to give us the best outcome, which is this one is actually something that I will discuss on Saturday. Okay.
Oh, yeah. Okay, so come on Saturday, right?
Yes.
Dr. Jansen will talk about the whole cancer journey as well. And he's going to share one of our cases from Child House. I think there will be two cancer survivors there that you can ask questions to. All right.
Yep.
Okay, so for our next question, it's coming from Miss Josephine Chua. Okay, it's about, is there any documented case of person with breast cancer who did not undergo operation but cured with taking PPARs? If already, yeah, please posted the video or uploaded it, please. And also the second question would be, is there a rest period necessary before taking PPARs after chemotherapy with paclitaxel?
Okay, Doc, I'll take the first part. You take the second one. All right.
Yes.
For documented case of breast cancer patients, yes, they are. I think if you take a look at our YouTube channel on internet, on Simply Nature YouTube channel, you will find maybe you go there and then within that channel search breast cancer. There are. I know there are many, right? A lot of times for us, for Simply Nature, because we distribute our products through doctors, we hear of the patients, but we are not able to get our hands on the patient's client profile because of course, patient privacy data issues, right? But yes, the answer is yes and yes and yes. All right. Especially if your cancer is in early stages. I saw someone down in the list highlighting that they just been diagnosed with cancer stage 1B. I forgot where I saw that, but so I can't remember which cancer, what type of cancer it is. But the first thing for most cases at stage 1, you can avoid chemotherapy with some provisions. All right. But first, to the breast cancer, yes, there is. However, I just also want to highlight to you, which Dr. Jansen will share, is that for breast cancer, because breast cancer is a very common cancer, so a lot of drugs have been developed for it, very specific for different types of breast cancer. So I would say that you might want to also keep your options open, because there are some hormonal treatments, immunotherapy treatments, which are very targeted for specific types of breast cancer. Don't close your doors to that. But if you want totally natural, yes, Simply Nature PPARs can. And if that's the case, go with the very strongest, because you're dealing with cancer. Go with either the liquid extract or the powder extract. Doc, what about the second part of the question?
Yeah, the second part of the question. So paclitaxel is a chemotherapeutic drug, no? You cannot mix this kind of chemotherapeutic drug with PPARs because it will counteract each other. Now, the way paclitaxel kills cancer cells is how PPARs actually. Okay, let me put it this way. Say for example, paclitaxel is your gun. How do you protect yourself from the bullet of the gun?
Bulletproof vest.
Yes, the bulletproof vest is the PPARs. Okay, it's yeah, that's how it works basically. So with paclitaxel, if you take PPARs, your bone marrow will be protected. But together with the bone marrow, the cancer cells might also get protected. Okay, so you cannot mix. So what I do for patients who are undergoing paclitaxel treatment is I give PPARs a week after they are given paclitaxel. Okay, I space it out because paclitaxel is given in cycles, right? Every 3 weeks. So I start PPARs after a week, 7 days later. Then a day before they undergo chemotherapy again, I tell them to stop taking already. Okay, that's how.
Okay, thank
I
you.
think this Doc, just to explore a little bit more is this. Of course, what do I want to say? I want to say this. All right. Number one, you do want to protect your body from the chemotherapy side effects, but it's kind of counterintuitive if you want to lower the effect of the chemotherapy during the chemotherapy treatment. So that's why you space it out. Doc, I just wanted to make a comment because this same person asked if it's natural. So I want to give a more complete answer. Last week I said that if I think the most honest answer, Doc, that we can ever give is, what would we do if we got cancer? You know, yeah. I've seen natural therapy doctors who go for chemotherapy. Then I've seen oncologists who don't go for chemotherapy when they get cancer. So you got the same story on both sides, right? So let's not target any one particular, but I will share what I would do, what Shan would do. I would try natural first with a red line. That means if I will tell myself, okay, I will try natural for 1 month. I'll do my scan. If the cancer cells don't grow, I will continue. If it grows by how much, then I will say I will continue my natural, but I will now add in chemotherapy. So what I'm just saying is that I will not just say only natural and nothing more. Neither will I say just chemotherapy and nothing else. So I personally, I think like most people, we would want to try natural first because we don't want to use drugs, so that we can use drugs at a later stage, you know, when things get more serious. So if you want to do natural, we are 100% behind you, supporting you, but we want you to do it with a red line. That means at some point, you know, okay, it may not be working as fast as I wanted to, and I will add in new options and new protocols. So that's what I personally would recommend for this particular viewer tonight. Doc, what about yourself? What if, I mean, I'm not touch wood, but you know, I'm not cursing you or anything. what if you got cancer? How would you approach it?
How I would approach it. Okay, this is in general not pertaining to any kind of type of cancer, but I go all out immediately. So if it's a solid tumor, then I'll have it removed. As long as it doesn't affect my quality of life, okay, significantly. Also, I'll consider both medications and natural treatments. I'll actually utilize both. Medicine procedures as well because I know a lot of them now. So I'll definitely utilize all.
Okay, see, there you go. Two of us, we have slightly differing opinions. So to our viewers, it's normal that, you know, some of you say, I don't want to do chemotherapy. Some of you say, I don't want to do surgery, but, you know, doc will do everything straight away. For me, I would also avoid surgery as long as I can. All right. So, but again, I think what I would do is I will avoid, but I will draw a red line. That means I will check my scans. If things are growing, then yes, I will go for that surgery. I will go for my chemotherapy as well. Okay. April.
Thank you, Doc and Sir Shine. I would also like to greet our new viewers from Santa Mesa, Manila, Qatar, Bicol, Las Piñas, different parts of the Philippines. And let me give the next question from Elizabeth Orbina Ravelo. Can a colon cancer patient who does not undergo chemotherapy can take PPARs as a supplement?
Oh yeah, most definitely. You should. If you're not going for chemotherapy, I strongly encourage you take at least the extract powder and if you can, the liquid extract.
And for next question from Sally Obejas, can I take PPARs even I take letrozole every day?
Yes, it doesn't have any interaction. This one, letrozole and PPAR, so definitely yes.
Okay, thank you. Thank you, Doc. For the next question from Pouch Zerk. Good evening. I am left MRM breast cancer stage 2A survivor and done 6 cycles chemo almost 10 years and half. But this August, the cancer was recurrence in my uterus diagnosed with endometrial cancer, stage 1, then operation of full hysterectomy, surgery including both ovary and negative for metastasis. What can you recommend for me for Simply Nature? Thank you.
Doc, number one,
Yeah.
this is not the breast cancer recurring, right? It sounds like a new cancer case.
Yes, but this person, I think, is on remission at this point. Yeah, because there's no evidence of tumors inside her body. But of course, this has to be still investigated. But for me, how would I investigate to know if there are any residual tumors? PET CT scan, whole body PET CT scan, definitely. Then if the result is negative, then yeah, just the tablets would be enough because the person is just is in remission. You see there, both ovaries are negative for metastases. I have to look at the lymph nodes, the status of the lymph nodes, if there are any enlarged lymph nodes inside her body. That lights up in the PET scan. So yeah, that's what I would do.
Yeah, for me, same advice as Dr. Jansen. Now, if the patient actually wants to, how shall we say, wants to be aggressive about, very, very aggressive about keeping herself strong, I would recommend maybe 1 month of the soft gel capsule. All right, why? Because it's stronger, right? Just to make sure, like it's like putting on extra sunscreen, and so that when you go into the ocean, it won't wash away easily, right? It's just and just 1 month, as Dr. Jansen says, if you're in full remission, the tablets should be fine, right? It should be sufficient. But the soft gel capsules are stronger than the tablets, so just as a booster for the first month, if you want a more aggressive approach or stronger approach, you can do that. And of course, the good news is that the soft gels, the tablets, they work for metabolic syndromes as well. They are very good for anti-aging. They lower your inflammation, and now we're in the post-COVID time. Most people are suffering from long COVID. Actually, internationally, many vaccine manufacturers are actually being sued, and also there is a lot of long COVID cases. It seems like chronic inflammation is more pronounced today than the past, but we don't really know. But I think personally, among my friends and myself, yeah, there seems to be a toll on our health. So taking the Simply Nature tablets and soft gel capsules will also address or strengthen you for these particular issues. So it's a win-win. Really recommend you to go on it. Just make a yell out in the chat, and I think one of the client service officers will get to you. Yeah, April.
Yes, Sir Shyan and Doc Jansen. By the way, for those of you who wish to have consult with Doc Jansen Kalalan, the link to schedule an appointment is in the description box, or just type in how to consult in the comment section below. Our pretty healthcare specialist, Beth, will reach out to you shortly. So for the last question, here it goes. As of now, my treatment is targeted therapy, which is I have to finish 18th cycle. I was diagnosed with breast cancer, stage 3A. I am now on my 8th cycle. Why is it to have finished 18th cycle?
Yes, because if you don't finish all 8 cycles, the probability of breast cancer.
Oh, Doc, you are fading in and out. We can't hear you, Doc.
Hello, I think it's the internet connection.
Okay.
Okay, I'm clear now. Okay. So for this one, you have to finish the 18 cycles. Why? Because the probability of the breast cancer getting dissolved or you going into remission, and, the recurrence rate going low is if you don't finish okay?
Oh, Doc, I think you're going in and out. Might be your iPhone. Sorry, your AirPods, the battery.
Yes.
No, I think it's the internet connection.
Okay.
Yeah.
Because I can hear you from April's microphone.
Okay, I think April should mute.
Okay.
Yeah, okay, yeah, that would be better. Okay. So okay, again, if you don't complete the 18 cycles, the chance of the cancer returning will be high, and the chance of the tumor, dissolving, shrinking it down would be lower. Okay, so it cannot be just finished 8, 12. It has to be 18. Okay, especially for these kinds of treatment targeted therapy. Usually, the treatment for this is longer.
So, Doc, am I correct to say that, the chemotherapy drugs and target therapy drugs, they are very, very well studied, right? They are very well studied in dosage. And to all our viewers listening today, there's a big difference when it comes to standardization between, let's say, a vitamin C capsule and a drug, all right? For example, you could be buying in Singapore, there are things like black garlic supplement, malunggay supplement, turmeric supplement. Every capsule of your black garlic and turmeric, there is a difference. So one batch might be a little bit more in this, a little bit more in that, because it's more natural, right? So that's why the dosaging for these capsules are more flexible. Now, when it comes to drugs have a deviation allowance of 0.1%, if I'm not wrong. Not even 1%, 0.1 or 0.01%. So every capsule of a drug is very, very specific. Every capsule is the same. They are not different at all. So what this means is that for all these drug therapies, the number of sessions that you are required for your illness is very specified. If you use less than that, they have studied so many cases, the effect will be less. Right? You also can't do more than that because the toxicity is also studied very closely. So I would say that stick to the protocol that your doctor gave you. But Dr. Jansen, sometimes there is this case. I have heard it. I've heard it before. Some doctors like to prescribe more than others. So as a patient, right? What if we don't know this doctor? And then maybe we are suspecting that the doctor might be prescribing more than is necessary. And since the patient themselves, we are not doctors, so we don't know what's the correct dosage. How should we go about solving this fear in our hearts that this particular doctor prescribes more chemotherapy than is needed, for example?
I think you have to be straightforward, no? Ask the doctor. Ask the doctor the question. Is it more than necessary?
So if he actually has to choose to lie or not to lie, it's very confrontational. And
yeah,
yeah.
Correct. But I mean, in the point of view of the doctor, for example, if if I were asked by the patient this question, I would be totally honest. And if I would be prescribing more than usual, I would, of course, tell the patient why. So that the patient would understand. I mean, cannot keep the patient in the dark. It's their body, right?
Yeah, it's true. You know, in med school, they study medical ethics a lot, and this is a very important issue, agency, right? To respect the patient's agency. Okay, so that's a very good tip, everybody. Ask your uncle. Because, doc, you are right, doc. Many doctors are not used to talking anything to talk. So if you don't ask, they just prescribe. They don't tell you why they prescribe. They don't share with you the discarte behind it. Yeah, I just want to share example of Dr. Jansen's advice in action, right? When my wife was seeing an OB-GYN, the OB-GYN prescribed certain progesterone, you know, for my wife. And then we were trying to have a baby, right? So I went to look online and I saw that it has the reverse effect of what we wanted. So, you know, I could be, but yet this doctor I'm seeing is a St. Luke's doctor, and she's very famous and very popular. So I didn't want to doubt her, right? So I did what Doc Jansen did. I asked her, Doc, I searched online. This is supposed to have a side effect. Why are you prescribing my wife this thing? And then the doctor was very nice. She actually explained to me, oh, yes, it's correct that it has this side effect, but in your wife's case, blah, 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 blah. Then I understood. So, Dr. Jansen, thank you for the advice. Yeah, just ask your doctor, right? Maybe you hear, how come everybody outside of the, you know, that's waiting to see the same doctor, they only have 5 cycles? How come yours is 10? You might be wondering, what did the doctor make a mistake? Ask, right? Just ask. April,
Thank you so
done.
much, Jansen. We're almost done with our webinar for tonight, but I can see a lot of questions still coming in. But don't worry, we will answer each of your questions next webinar via direct message, or you can send us a message so that we can line it up for next webinar. By the way, Sir Shyan and Doc Jansen, just before we say goodbye, kindly give our viewers parting words for tonight. Sir Shyan?
Okay, for me is we always enjoy this session, especially for me and Doc Jansen. We have very busy weeks, but this is a time where we sort of relax and be able to answer your questions. It's also very nice when some questions are new, forcing us to ask ourselves as well. So again, thank you very much for supporting this program. And our commitment to you, our audience, is that we will always be here every Thursday. Sometimes, like last week, when Dr. Jansen can't make it, I will still be here. When I'm flying around, Dr. Jansen will be here. If we both can't be here, we'll find another doctor to stand in. But we want to make sure that we are here to answer your questions. So thank you very much. And I hope to see as many of you as possible on Saturday. And those of you who are our regular viewers, when you're on Saturday, when you see me and Dr. Jansen, please tell us, hey, I watch you every Thursday, all right? So that we know. We also want to recognize you. All right, thank you. Doc?
Yeah, it's correct. I actually have a lot of patients that I am seeing now who are viewers, just like you, no? And it's actually quite pleasing to hear that these people are watching us every Thursday, waiting for Thursday night. And it's really good to know that we are actually giving great value to them. Yeah, so it's basically what keeps us going. So please be there for us as well, because we need you to keep this going. Because if it were not for you, what's the point of this, right? So yeah, I think that's it. And I would, of course, very much want to see you on Saturday. Yeah, see you then.
Thank you, Sir Shyan, and thank you, Doc Jansen. To keep yourself updated with our latest online events and promos, please like our Facebook page and subscribe to our YouTube channel. And also, let me inform you that we hope to see you all in our future webinars to come next week, October 19, Thursday, same time, 7:30 p.m. Our topic is entitled Breast Cancer, Why My Treatment Didn't Work. For those of you who are already registered for our upcoming health seminar, you will be able to meet our panel of experts, Mr. Shyan Lim, Dr. Jansen and Dr. Jimmy Catapia, happening this October 14, Saturday, 8 a.m. to 11 a.m. in SMX Convention Center at SMX Aura Taguig in partnership with Cultura. Take advantage of the 10% discount. But wait, there's more. For every purchase of 10,000 worth of products, or if you purchase a tri-pack capsule, you will get a free 5 pieces sachet of Cleansing Plus. Not just that, if you avail our Peepers Liquid Extract or Peepers Powder Extract, you will get a free 1 bottle of Peepers Tablet. Isn't it amazing? Yeah, and also there is so much in store for our registrants, right? So if you haven't registered yet, what are you waiting for? Register now. There are only few seats left. I know we are all here to invest in our health. That's why there's no more excuse. For as low as 650, you can start your health journey with us. Via official Shopee or Lazada Mall, we also have promotional offer for all of you. Please avail our Kickstart or Power Pack for detoxification, immune system boosting through complete nutrition. The management has approved a buy 10 get 1 as an advanced holiday season. So don't wait for the holiday rush to get the best gift of health. Once again, thank you for watching the Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health and your victory over cancer and metabolic diseases is what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.